Definitely seen a lot of people come through, and it may not exactly say heat stroke or heat exhaustion on their paperwork, but they're complications, and it is bringing a number of people to the hospital.
I've personally, in the last couple of days, seen quite a few. I would say maybe 10 or 20% more than normal. People who wouldn't even be in the emergency room were it not for the heat.
The emergency physicians at Providence Hospital are seeing an influx of patients suffering from the heat. Dr. Steve McGraw says he alone has treated at least 5 different people with heat-related illnesses, including a 91-year-old who was dizzy.
I took care of a gentleman just now whose real complaint is that he just, quote, felt dizzy. But he was profoundly dehydrated, and he's already in sort of the first and second stages of kidney failure. Now, we'll correct that here in the hospital, but he has to stay in the hospital and get IV fluid. His family just noted that the things he was normally able to do, walk, dress himself, and actually take a bath, he couldn't do today. So they brought him in for weakness, but in fact, he was really dehydrated.
Most of the people have underlying health issues that are being exacerbated by the heat.
What we're seeing is that people that have medical problems, especially pulmonary and cardiovascular complaints, who are otherwise doing well, this is just enough of an extra stress that can make their disease less manageable to them. So where they might feel better with a breathing treatment or a little use of their inhaler, they're not getting better like they otherwise might because of the humidity and the heat.
Yeah, it is just enough to push them over the edge. The big problem, we are told, is dehydration, that you have to keep drinking fluids, that you really have to stay on top of that and really keep rehydrating, even if you don't feel like you need it, that you just have to do it, especially in this unbearable heat. The other thing is the doctor was saying, please check on your elderly neighbors, people that don't have someone checking on them all the time. Make sure you look in on them, make sure you're checking to make sure they are properly hydrated as well. Reporting live at Providence Hospital, I'm Mary Conway, Channel 7 Action News.